Assalamu alaikum. Dear students, in the previous session, we have started and one of the occupational disease, that's asbestosis, where we have briefly touched upon the disease. What's asbestosis? What's asbestos? And what are the vulnerable groups of people which are the high risk of getting the disease? And how it affects our lungs? And what are the people, vulnerable groups? What are the occupations? Are the people the specific occupations with which disease is connected? As it's an occupational disease, it is related to one's occupation. The working conditions and the environment, working environment, has major role in accelerating or starting the disease. Today we will be touching upon the symptoms. What are the various symptoms which lead us to the conclusion that the patient is suffering from asbestosis? The symptoms can range from mild to severe, which usually do not appear until many years after exposure. The long-term exposure to asbestos does not show effects up for 10 to 40 years after initial exposure. Some major symptoms include dry cough, shortness of breath, loss of appetite, chest pain, fatigue, loss of weight and appetite, cracking, sound while breathing, and advanced symptoms like wider and rounder fingers and toes than normal, pulmonary hypertension. Its diagnosis requires through medical and occupational histories being besides medical testing, chest x-ray, lung function test, and CT scan and more are some of the tests recommended for its diagnosis. So the major symptoms of this disease include dry cough, shortness of breath, loss of appetite, chest pain, fatigue, loss of weight and appetite. One of the leading revealing symptoms is the cracking sound while breathing. In diagnosis, the diagnostic part, your history, occupational history is required, and through medical testing, it can be also ascertained that the patient is suffering from asbestosis, like some of the tests which include in the early diagnosis of the disease are chest x-ray, lung infection test, CT scan. These are recommended by the experts to get to the conclusion that the patient is suffering from asbestosis. Thank you.